Happy New Year to you and your loved ones. Welcome to your favorite health program on TV, Health Affair, a platform where we explore public health challenges, issues about women and children, proffering lasting solutions. I'm your regular anchor, Ushuomowa Daniels. On the program today, we shall be discussing about stroke. Please stay tuned. We'll be right back after our new segment to tell you everything you need to know about stroke.
The World Health Organization, WHO, has warned that blanket COVID-19 vaccine booster programs could prolong the pandemic rather than end it. The DG WHO, Tedros Ghebreyesus, who gave this warning, says no country can boost its way out of the pandemic. The DG stressed that priority must be on supporting countries to vaccinate 40% of their population as quickly as possible and 70% by the middle of 2022. Still speaking, he declared the vaccine effective against both the Delta and Omicron variants. The DG also encouraged for safety precautions in the Yuletide season. The federal government has destroyed over 1 million doses of AstraZeneca vaccines donated to combat COVID-19. The Executive Director, National Primary Healthcare Development Agency, Faisal Shuaib, led the destruction at Gosa dump site, about 2 kilometers from the Idu railway station, Abuja. While speaking, Shuaib says the agency came through in its promise to be transparent to all Nigerians. He also spoke about the agency's collaboration with NAFDAC, who took the decision to destroy the vaccines. Mojisola Adeyeye, DG NAFDAC, while speaking, added that Nigerians deserve the best in terms of quality of medicines and vaccines. The windy Harmattan season is projected to fall an increase in cases of COVID-19 in Nigeria, leading to a fourth wave. The Director General, Nigeria Center for Disease Control, Ifedayo Adetifa, said this during a virtual meeting with journalists. Nigeria is currently battling the fourth phase of the COVID-19 pandemic. According to the NCDC chief, the Omicron variant is gradually becoming the leading strain, spreading new infections. Giving data on the situation, the incident manager of the National COVID-19 Emergency Operations Center, Rejoice Luka Lawal, said 49 cases of Omicron have so far been detected in Nigeria through genomic sequencing. As Nigerians bask in the Yuletide, the NCDC is promoting the Celebrate Responsibly, a campaign in which authorities are urging Nigerians to adhere strictly to public health safety measures while encouraging those who are yet to get vaccinated to do so in order to stem the spread. The Lagos State Ministry of Health has developed strategic plans bordering on improved data management, strict implementation of regulations, income generation and budget performance to better position the state health sector for better service delivery in the year 2022. Speaking on the issue, the Commissioner for Health, Akin Abayomi, explained that the developed strategic plans are geared towards enhancing creative problem-solving and decision-making skills in achieving an efficient healthcare system in Lagos. He added that the Ministry of Health is set to improve on data processing and management, set standard and prototype in the delivery of health services. Abayomi also stated the ministry's goal to provide quality services to residents while responding swiftly to situations and challenges.
To revive the education sector in Nigeria, there must be a greater involvement of all students. This was the opinion of speakers at the Faculty of Clinical Sciences, College of Medicine, University of Lagos first alumnus lecture and end-of-year celebration. It had as its theme, celebrating our alumni and advancing the development of our institution.
We started this lecture as a foundation one to actually bring the alumni back to the faculty. The faculty is part of the college and part of the university, and bringing them back is for them to come and support the faculty, because the government cannot do it alone, to support us in our research, training and services that we are rendering for the college and the university.
The alumni have been found to be a very important part of any institution, and we at the College of Medicine have come to realize and celebrate our alumni because they've been fantastic. We have our Alumni Wall of Honor, where the list of alumni that have done notable things in our faculty it's tremendous, the role they've played and the fact that they've been the backbone of the institution. And so today was brought out as a day to celebrate them, to encourage them, and also to help them see how they can come in to help lift the institution even higher. So
they are the major stakeholders. When you see someone from a particular university, the way he comports himself, the way he behaves, how professional he is speaks volumes about the institution. Therefore, the institution must make sure they celebrate their alumni and bring them near so that they continue to carry and be good ambassadors. Also, the alumni are major stakeholders in funding the education institution, because it has become apparent that the government cannot fund education alone. Philanthropy in our culture does not take education seriously because of the quid pro quo aspect. What is in it for me? People want to know, what do they gain if they give out? The people don't just give for giving out. When they give to churches or mosques, they believe that God will bless them. That's why they do. But when they give to tertiary education, they do not see the result in time. So advancement officers have to make sure that people are made to realize of not only short-term gain, but long-term gains of giving. And that is why something like this Hall of Fame is there. Let those who have given have their name recorded. When somebody has given you something, let his name be engraved there. People don't mind giving if you convince them that way. But just say, donate to our cause, and nothing they are getting from it. It's not in our culture to give.
With the ravaging coronavirus and fourth wave of the COVID-19 pandemic, the speakers also called for caution.
Well, thank God from what we are hearing, Omicron is not is about the same thing, even though the infectious rate may be higher. I think the basic thing is for Nigerians to stick to the fact that COVID-19 is still here, and therefore the regular advice of washing our hands, using our face masks, and social distancing should be strictly adhered to. With that, I think sensitization has to continue. Well, a lot of Nigerians either don't believe it or believe it has gone. So the government has to step up its campaign to let people know the dangers of the COVID-19 existence within Nigerian politics.
High point of the event was the presentation of awards to individuals who have distinguished themselves in their various fields of endeavor.
An award coming from your colleagues who are not just colleagues, are senior colleagues, my teachers and mentors. And for them to consider that what we did was worthy of commendation is very encouraging. It means not just me but the whole team as a whole. It's encouraging to us. At least it shows that the little we did, was meant something to the institution, and that we also were able to contribute our own way in advancing the institution. So it's very, very encouraging to me.
Members of Ikeja Unique Lions Club have called on Nigerians to keep safe and stay healthy by keeping their environment clean and beautiful, especially with the ravaging coronavirus and COVID-19 pandemic. They made this call during the light-up of the adopted garden on Governor's Road, Alausa Secretariat, Ikeja, on Monday, 20th December 2021.
It's wonderful. This is eye-catching. Very happy that we have been able to do this. and I congratulate the President and all members of Ikeja Unique Lions Club for this landmark project. Nigeria love, we wish Nigeria joy, we wish us peace, we wish us improved security in our land.
It's a commitment to the protection and preservation of the environment, and we can clearly see what we have been able to do. This environment has been beautified, and I know a lot of people in this environment will be so happy to have this new thing.
It's only when they go to Victoria Island that they see this. Now this is on the mainland, and by the grace of God, we are praying that when the next president comes in, we can sustain it, so it will be an ongoing thing. And we want to thank our district governor, all our friends that have come in, especially you, the media, that have taken your time to come and cover this event.
It's a time for sober reflection as we celebrate the birth of Christ. Christ is known for peace and love. Let's pray for peace. Let's pray for love. Let's pray for beautification of our environment. Let's take care of our environment. If we can take care of environment, we take care of our health.
Forget, this is COVID time. Take your vaccines, boost, and obey the regulations.
They also advised Nigerians to be prudent in spending during the Yuletide and expect a better Nigeria in 2022.
People with the kind of economy that we have presently, it looks gloomy. But when people passes through something like this, they'll say, oh wow, at least momentarily, they forget whatever they are passing through and appreciate the environment better. But we just need to let people know that this season, it's a season of festivity. At the same time, it's a season for caution. If you don't hang like others, don't compare anybody. It's just Jesus Christ's birthday, and it's just one day. So every day is like Christmas. Your own birthday will come, others' birthday will come. So just do things within limits.
The light up of Ikeja with Christmas decoration is the club's end-of-year project.
We wish you a Merry Christmas. We wish you a Merry Christmas.
Members of the Nigerian Medical Association have called on the federal government to give adequate attention to the health needs of the elderly and make it a top priority in policy process. Speaking with newsmen in Lagos at the 2021 NMA Elders Forum, members of the association noted that people who have put in so much in the service of their father's land usually have peculiar health needs at old age.
That forum is one of our traditions where we keep in touch with past leaders of the association, past officers, and also past physicians who has worked either in the state government or private setting or federal government, who has contributed their quota into the growth of medical practice. And it's an avenue where we continue to take and benefit from their advisory role. We usually use that avenue to also wine and dine with them, celebrate with them for all they have done for us, you younger ones, and to also use as a point of contact for our younger ones to be able to emulate some of the good things they have done. So we usually have this as a tradition, but 2020, because of the COVID year, we couldn't have that. So one of the other things that comes from it is that when there are issues that have to do with emergency or urgent need for advice, it is such avenue that we get to have a pool of resources of our brains, best brains that we have had in the country and are still alive.
The peculiar health needs, it spans from physical to psychological. You know, at this age, many of their children have left home. Some of them are depressed. Some of them have physical needs. Some of them have all these chronic illnesses. So we want insurance for them, health insurance, especially for those that are not covered. It's not everybody that when you retire, you still have opportunity to have health insurance. And our health insurance scheme, at a particular age, does not cover the elderly. So we want it to be an all-inclusive thing so that no matter your age, you still know that you don't have to crack your head when you're falling ill. You can walk into the hospital and you're sure that your health needs will be taken care of irrespective.
There should be a real paradigm shift in approach to the elderly, both at formal sector level as pensioners, and even the informal ones who has been a carpenter or whatever and has become old there must be ways of making life bearable for them. It must be the duties of certain people at various levels of government, whether local government, state government, or federal, to specifically focus on them, both especially for their health care and for their remuneration, where they have subscribed to pension plans.
It's not just about government, it's about the people themselves. But of course, government needs to prepare services. There are very few services dedicated to the elderly. And there are very few packages. In fact, there are no packages at all in a formal sense that pertain to growing old in this society. In other societies, as you formally attain the age of 60 or 65, you have some packages within the society. Apart from acquiring respect, you get free bus passes, free train rides, some privileges even in commercial stores and commercial transactions. We don't have any of that here, and we need to build them into our structure.
The forum, which had as its theme, the elderly medical elder living through the realities of post-retirement, provided an opportunity to address some challenges in the health sector and the way forward.
The health sector in Nigeria is plagued by very poor system. The system which we have all understood of primary care, taking care of 70 to 80% of the problems, before secondary care, and then tertiary care. Most of the attention that is being paid is to the tertiary care, whereas most of the problem can be tackled at primary care. Unfortunately, by our constitution, the primary health care is left to local government. Local government is one of the least funded and least strengthened part of our governance. So we have to strengthen the primary health care.
We ensure that government continue to look at the strategic plan for health and make sure that the issue about the increase in budget for health is there, and to make sure that the universal health coverage is a key factor, and the issue of the basic fund from the National Health Act is also being followed so that we can do some of the things we plan to do.
Individuals who have contributed their quota to this sector were honored.
This award is by the Nigerian Medical Association. It's an appreciation award presented to Chief Dr. Oluyomi Abayomi Figu as a panelist at the 2021 NMA Lagos Elders Forum of Foremost Elders. Congratulations.
Thank you. Congratulations, sir. Thank you for
the appreciation award presented to Dr. Titilayo Goncalves, that is the past Permanent Secretary, Minister of Health, as a panelist at the 2021 NMA Lagos Elders Forum. Your continuous support, commitment, and contribution is greatly appreciated on 18th of December 2021.
I have the privilege to present this award, appreciation award, to Dr. Oluwajimi Sodipo as the moderator at the 2021 NMA Lagos Elders Forum. Your continuous support, commitment, and contribution is greatly appreciated. Thank you very much.
The Lagos State NMA is presenting this appreciation award to you, Dr. Mrs. Evelyn Ishikela, immediate past president, NDA, as a panelist at the 2021 NMA Lagos Elders Forum. Your continued support, commitment, and contribution is greatly appreciated. Today, 18th of December, 2021. Congratulations.
Congratulations, ma'am. Congratulations. Thank you. 1, 2, 3. Congratulations. Congratulations. Please also sing an LOC. You can quickly join in.
Welcome back. All parts of the human body require adequate and uninterrupted blood supply. The disruption of this blood flow to any part of the body results in the death of tissues, which in turn leads to a stroke. According to figures from World Stroke Organization, 1 in every 4 people will suffer a stroke in their lifetime, and 1 in 8 deaths worldwide is caused by stroke. We have an expert on the program today to tell us more about stroke. He's Professor Olajide Olawale, a consultant physiotherapist.
There are blood vessels, arteries that carry blood to the brain also. When there's a disruption in that blood flow, it results in a stroke. And this disruption can be in 2 ways. It's either the blood vessel is blocked, that's one way it can happen, or the blood vessel ruptures, which we call a hemorrhage. In any of these two, when any of these 2 situations occur, that is a stroke. It's actually a disruption of blood flow to the part of the brain, and that is what we call a stroke.
How will you describe the stroke situation in Nigeria? Is it getting common? If it's getting common, why is it getting common?
We may not have specific statistics to back it up, but common observations show that it's a condition that is getting more common, in the sense that we have more cases being reported here and there in hospitals and different places now. So, but due to so many factors and due to common observation that we can make, we can say that it's increasing, especially backed by WHO statistics, which has reported that in recent years there's an increase in cardiovascular diseases, including stroke, in low and middle income countries, and Nigeria is one of those countries.
So who are always at risk of stroke, and what are the signs and symptoms to look out for?
Let's take it one by one. Who are the risk of having a stroke? It's everybody, but the risk increases with age. So older people are more likely to have it. But there's one important factor that is a very predominant risk factor for stroke, and that is high blood pressure. In other words, if somebody has elevated blood pressure that is not controlled, the blood pressure keeps going up and you are not under medication or anything to control it, one is at a risk. So high blood pressure is the most important risk factor. The second one, which I mentioned earlier, is increasing age, cigarette smoking, excessive alcoholic consumption, excessive body weight, that's obesity, and so on and so forth. With all this, if anybody has any of this or a combination of many of them, is at a higher risk of having a stroke than the general population. You have the paralysis or paresis either on the left or the right, depending on which part of the brain in which the lesion occurs. The general observation is this: if the lesion occurs on the right side of the brain, then the person will have the paralysis or paresis on the left side of the body. And if it happens on the left side of the brain, you will have the paralysis or paresis on the right side of the body. That's why you have people having it on the right or on the left.
So which one is more deadly?
We don't normally talk of which one is more deadly. The two are deadly. I mean, the same statistics back the two of them up. In other words, if somebody has a stroke, consequences of dying or not does not depend on whether it occurs on the left or the right. A stroke is a stroke.
I understand there are different types of stroke. What are the different types of strokes?
There are 2 main types. One is due to the gradual narrowing of the blood vessels. We call it blood vessels in the brain. We call it ischemic stroke. It's more common. In other words, those blood vessels start getting narrowed over the years due to deposition of fatty deposits in the blood vessels, and that can result in a stroke. That one is more common. That one is called ischemic type of stroke. The second type is the hemorrhagic type of stroke, which occurs when a blood vessel ruptures or bursts. When that happens, you find blood spilling into the blood tissue and so on. It's not as common as the other one. It's just about 5 to 15% of the cases that have the hemorrhagic type. So one is due to narrowing of the blood vessels. The other one is due to narrowing leading to blockage of the blood vessel, and the other one is due to rupture of the blood vessel.
So how fatal is stroke? How serious, how deadly is stroke? Then Nigerians want to know if something is deadly, they take precaution and all that.
The statistics to back it up is, it's based on general studies. You find that those who have a stroke, 30% of them may die immediately. After some time, another 10% may die. The rest will be left with a number of impairments, and they can once they have survived it, they can live with it for many years thereafter, depending on the type of care they got and the rehabilitation they go through thereafter. Care is available in different hospitals, primary health centers, general hospitals, teaching hospitals, and so on and so forth. One can access care there. It depends on what you do immediately it occurs. Know the right place to go. Most of our hospitals, when you go there timely, immediately it occurs, you have people who will look after it. Those who will give the immediate care and those who will take care of the rehabilitation thereafter to ensure that you get the type of treatment or follow-up care that stroke needs. Stroke is one of the conditions that can happen, and one can manage it through the National Health Insurance. But then how many people are enrolled on the National Health Insurance? But just as we said, it's not something that is inexpensive to manage. It's a high-cost neurological condition. You need money, you need resources, you need people to be able to manage it. Immediate people, we call them carers, who are close to you to assist you in different forms of rehabilitation that the patient needs. So it's very costly. Let's be frank about that one.
Is there any particular food they should eat or what they should not eat? Exercise that they should do or what they should not do?
Talking of food, there is no hard and fast rule. It's just to avoid eating those type of foods that have been recognized earlier, that can lead to excessive weight or obesity, in the sense that you don't eat food that is too rich in fat or fatty substances that can also increase the formation of plaques that can block or reduce the size of blood vessels that can lead to a stroke. So you avoid fatty food. You eat what we call, well, maybe we are not used to that term here, Mediterranean type of food. That is type of food that is rich in fruits, vegetable, whole grains, and so on and so forth, and and is less in salt and so on and so forth. Those things that are not desirable for the body.
Dr. Chigo, you talked about vital signs. A lot of people don't know what they call vital signs, and we used to have a bit of people not going for medical check. So what's the take-home message? What is it about vital signs? What should we know, and how do we get to monitor our vital signs?
I think the most important one this time around is to look at the blood pressure. We mentioned before that high blood pressure is the most important risk factor, is the most prevalent risk factor for stroke. So one should monitor his blood pressure on a regular basis, so that once it is getting high, then you now consult, seek medical attention to do what? To ensure that it doesn't go beyond normal. The normal limit is what you call 120/80. So once it is going above maybe 140/90, it's getting high. So control it. Once you control blood pressure, and your blood pressure does not become high beyond that normal level, then that's the most important vital sign you should watch out for in control of stroke. So apart from blood pressure, watch your diet, the one we have talked about before. Then if you are a smoker, stop smoking. If you are drinking, don't drink excessively. Then control your body weight so that one does not become obese. If you take all these measures together, those who are diabetic, they should control the diabetes. So if you do all this, then you are already talking of all the preventive measures that you need. And that it applies to any one of us. to prevent a stroke. We use an acronym. You know, when a person has a stroke, look at his face. Are you following me? You just see one side wrinkled, the other side smooth. Look at the face. You look at the arms. It's a question of just saying, lift up your two arms. You'll find that one is moving higher more than the others. Are you following me? And you now ask the person some questions and watch how he will reply. Well, that is, we are looking at the speech. Is that okay? So we use the acronym FAST. The face, the arm, the speech, and then the T stands for what you call timely intervention. So that when you observe any of those three signs, the one side of the face being wrinkled, the arm, the two not moving well, and then slurred speech, then what do? Timely intervention. Carry the person to where he will get immediate treatment.
Thank you very much. It was nice having you on Health Affair. We appreciate it.
Thank you very much. I appreciate you too. It's my pleasure talking to you. Thank you.
Just joining us, it's Health Affair on AIT. We'll be right back after this break. Next on the program is our nutrition segment.
Scent leaf, commonly known as clove basil in English and efirin in Yoruba, is a strong aromatic herb native to Nigeria, Ghana, and some parts of Africa and Asia. It is found in farms, gardens, and mainly used as a spice for cooking delicacies due to its aromatic taste. Scent leaf has antibacterial activities against Staphylococcus aureus, Salmonella, and Candida albicans. It is also a repellent against houseflies, mosquitoes, and other insects. As a vegetable seasoning, it gives every meal a delightful, unique, and sweet taste. From research findings, there are numerous health benefits from scent leaf. Scent leaf aids digestion. It helps bowel evacuation and weight management. It can be used to treat oral infections as it kills all bacteria in the mouth which cause tooth decay and bad breath. Scent leaf is used in the treatment of fever, cold, catarrh, as well as skin infections like ringworm. Scent leaf has antibacterial activities against Staphylococcus aureus, Salmonella enteritis. Extracts from scent leaf has also been reported to lower blood pressure, blood sugar, and potent for the treatment of gastroenteritis and lots more. Scent leaf can be taken as a tonic. It can be taken like salad or added to dishes during cooking.
In our clinical segment, we give you tips for healthy living.
When there's a case of rape, there are certain steps that must be taken. The victim must not bath. The victim must not eat. The victim must not change the clothes. And if there's a condom that has been used, that condom must not be destroyed. These are the evidences that should be taken to the hospital. Once a child or a victim has been raped, they get the wrong advice and then quickly go and have your bath. The moment that person has had the bath, that's it, we lost the evidence. So it's very difficult to nail the perpetrator.
Be a part of nation building by telling us how to improve on human lives and the nation's health sector.
what we've noticed is the fact that people are not really observing the protocols to maintain safety during this period. So there's Christmas, everybody's going around like it's normal thing every day without COVID-19 in town. People are not observing social distance. Nobody's really using their face mask. I don't see anybody with hand sanitizers the way we used to, in 2020. So there's a bit of a relaxed atmosphere where everybody just feels COVID-19 is just like a higher level of malaria. Even if you get infected, you get over it, you'll be fine and you'll be okay. So that's what the perception is, and that's what I see. Increase awareness. And I don't think we should also leave that to just the government. You and I, within our own vicinity, within our territory, we could, speak to people, make them aware that actually there is COVID-19 and that we have the Omicron variant, for instance, in circulation. And, the fact that we're also in the Harmattan season and it's dry, generally people are coughing. You can attribute it to either the Harmattan or the weather, or is it COVID and all of that. So, but if we observe all the protocols, ensure that we wash our hands, use hand sanitizers, use our face masks, maintain social distance as much as possible, don't just expose yourself and your family members and other people actually too. And if you're coughing, maybe just stay at home as much as you can and ensure that they're safe. Everyone around you is also safe, apart from you.
This is where we draw the curtain on the program today. Thanks for spending your time with us. Please let's do it again same time next week. My name is Oshomo Daniels. Happy New Year 2022.